Welcome to Diagnosing Health Care, a podcast featuring thought-provoking conversations about the latest legal, policy, and regulatory issues in healthcare. While these issues may seem like hurdles, we'll also look at the business opportunities and solutions that exist. Diagnosing Healthcare is brought to you by the healthcare lawyers at Epstein, Becker, Green, a leading law firm that has more than 40 years' experience serving clients in the healthcare industry nationwide.
Hello, everyone, and welcome to Diagnosing Healthcare. I'm your host, Jessika Tuazon, an attorney in Epstein, Becker, and Green's Healthcare and Life Sciences practice, based in our Los Angeles office. In today's episode, we are going to discuss considerations for healthcare businesses and employers looking to implement COVID-19 contact tracing tools. We will explore the major data privacy and security issues surrounding contact tracing, consent requirements, and considerations for balancing a public safety concern with individual privacy rights. During the COVID-19 pandemic, we have seen widespread virus and antibody testing, temperature taking, and social distancing measures put into place. However, to get the economy back up and running, businesses across industries will need to implement a much more focused strategy. Here to discuss these issues are two of my colleagues, Michelle Capezza, based in our New York City office, and Karen Mandelbaum, based in our Washington, D.C. office. Michelle has over 20 years of experience advising companies with respect to all aspects of employee benefits law. She also advises clients on the implications of increased automation and artificial intelligence in the workplace and the related benefits and compensation considerations for a changing workforce. Karen advises clients on all aspects of federal and state privacy and consumer data protection laws. Prior to joining EBG, Karen served as a senior advisor for security and privacy policy and governance to the Chief Information Officer, Chief Information Security Officer, and Senior Official for Privacy in the Office of Information Technology at the Centers for Medicare and Medicaid Services. Welcome, Michelle and Karen.
Hi, Jessica. Thank you for having us here today.
Hi, Jessica. Thanks. It's great to be here.
Well, to kick off our discussion today, do you have any suggestions on what employers should be thinking about before they purchase any contact tracing technology and/or provide it to their employees to use?
Well, Jessica, we start from the premise that contact tracing is not a new concept. It has been a long-standing and important component of infectious disease control, but it has historically been performed manually by individuals managing patient care, and usually on a smaller scale. Today, we have a global pandemic caused by a highly contagious airborne virus. We all know that we need to control and eradicate this and to return to our workplaces, reopen businesses and venues, and be able to gather in groups. And the one positive is that we have technology today that can be used for contact tracing and notification purposes, but we need to use the technology wisely and understand what we are introducing into our lives. So there are certain things employers should do at a minimum before introducing these tools and apps into the workplace, such as vetting the vendors of these solutions and their privacy and security practices, including diligence around the vendor, what they will collect, how they will encrypt the data, its use of the data, and the type of technologies involved, whether they use Bluetooth, providing anonymous notifications, or whether it is a GPS-based tool providing specific locations of individuals, which is more intrusive. They need to vet the tools and apps for privacy and security controls and review their terms of service and ensure there are privacy and security protections and service agreements and perform diligence to ensure the tools and apps comply with the employer's overall cybersecurity procedure and protocols, and that there are clear data breach notification procedures in place and cyber insurance. And also, at all times, complying with applicable laws in their jurisdiction around disclosures and consents to collect employee information. It's really critical to verify that the technology will be used for its intended purpose, that efforts are made to minimize data collection and to understand how the tool or app will be updated to remain compliant with changing laws. Even the definition of close contact changed in October. Karen, what are some of the first things you review with employers deploying these tools or apps?
So whenever I'm asked to advise clients who are about to deploy a contact tracing tool or an app in the workplace, some of the first things I ask them are, have you reviewed the terms and conditions from the vendor? Sometimes buried in the terms and conditions are provisions that allow the app developer to make secondary uses of disclosures of the information that the app collects, or that allow the app developer or the technology to de-identify the data and reuse it, or link the information that's collected for contact tracing to other applications that the developer offers. It suddenly seems creepy when the client realizes that they are not the only ones that might have access to their employees' data. I also ask if they have considered what information the tool or app collects about each employee, and if the tool or app is collecting more information than is actually necessary. For example, the CDC recommends, and most state plans suggest, that a temperature above 100.4 degrees is suspicious or a symptom of COVID-19. Most apps only record that the individual either passes or fails the temperature check. But some tools and apps collect the employee's actual temperature. In the state of New York, the reopening plan expressly prohibits recording and maintaining the actual temperatures of individuals. This often leads to a conversation about what the state plans require. Sometimes employers have locations in more than one state, and considering many states have changed their reopening plans a number of times, and they likely will continue to make changes, another key recommendation is to help employers think about how and what they're going to communicate to their workforce about the tool or app that will be deployed. Establishing open lines of communication, communicating often, and answering questions as often as possible can go a long way in building trust and ensuring that employees will cooperate with contact tracing efforts. Finally, it's always important for employers to consider state law implications. Contact tracing tools and apps have the potential to trigger certain provisions in state privacy and data security laws. For example, some state data security laws require that a written notice is required when a biometric identifier like facial imaging is collected, and some apps and technologies even collect facial images along with those temperatures. As a general rule, employers shouldn't be reticent to use automated contact tracing tools and apps. They just have to know what to look for, make sure that they are informed about how the apps and tools work, that they understand what and how apps use information, and continue to monitor their use to make sure that they are effective and they're doing what they're supposed to be doing. Even if an employer has already decided on or has deployed a tool or app in their workplace, I encourage them to revisit the terms and conditions or their contracts with the IT developers to make sure that there isn't anything happening that's unexpected.
At a high level, what do you consider to be the most significant privacy or security concerns related to the use of contact tracing technologies?
So that's a really good question. Even though most contact tracing tools and apps are unlikely to be covered by a federal regulation like the HIPAA privacy and security rules, employers should still take steps and consider how the information being collected is being protected, ensure that they tell employees what, how, and by whom information about them and their COVID status will be used and disclosed, and how long it will be retained. Employers also have to make sure that if there are any state requirements to provide notice or get consent before collecting certain kinds of personal information, that there is a mechanism in place to do that as well. In theory, an employee could limit his or her employer's right to access only certain types of information. For example, biometric identifiers could be excluded. To enable an employee to do so, the employer should ensure that the app authorization can be tailored to permit such a narrow authorization. Otherwise, with most app authorizations being provided via click wrap text, it's usually that an individual cannot modify the authorization to limit such data access. Also, to the extent the mobile tracking tool or app seeks to collect protected health information, there are new interoperability rules that shift the responsibility to the individual to decide whether they would like to share their protected health information with a third party, like their employer. These rules permit individuals to access and request that their electronic protected health information, like their results of a COVID test, be transmitted to mobile apps through application programming interfaces or open APIs. The Office of the National Coordinator for Health IT final rule that was published on May 1st, 2020, requires developers of certified health IT to include secure, standards-based APIs to support patient access and offers individuals control of their own electronic protected health information to share with whomever they wish. Over the past few years, a handful of states have taken the initiative to enact data security and privacy laws that require businesses to protect personal information that is maintained electronically, and when an incident or breach occurs, they have to report it to state law enforcement and notify and offer credit protection to the individuals whose information has been compromised. Some states have considered extending a private cause of action to individuals when their rights under the state laws have been violated. Not only do these state laws give enforcement authority to impose sanctions when a company is in violation, they also open the door to litigation from employees and other individuals whose information is collected using contact tracing technologies. With respect to COVID-19, the longer employers, schools, airlines, and other venues screen people and collect personal information, and the more accustomed we become to providing that information, the more likely that at least some aspects of these technologies may persist into the future. At the same time, several technology companies have begun integrating thermal imaging with facial recognition technologies to offer an efficient contactless way to screen large groups of travelers or employees or other individuals. Others have integrated methods to screen for respiratory patterns, heart rates, and sneezing and coughing. While these technologies may seem promising for containing the spread of COVID-19, they are more invasive and collect more information than you would think. And once these technologies are leveraged, there is a great risk that they will persist beyond the current public health emergency. Just like, for example, many of the privacy concessions that were made under the U.S. Patriot Act in the wake of September 11th. They became permanent fixtures in our daily lives.
Thanks, Karen. Michelle, is there a way to implement a tracking tool without collecting medical information or PHI?
There is. Employers can limit data collection by deploying wearable tools such as lanyards or wristbands. And there are some products designed as tokens or cards that employees can carry on a belt or in a pocket. These can be worn by employees solely in the confine of the workplace. And they're used to identify an employee's location in the workplace throughout the workday and identify close contact with other individuals, and also to remind the employees to remain the recommended distance away from each other, so that there's an alarm or notification that employees would receive to remind them to keep a safe distance. These typically use proximity sensors powered by Bluetooth and ultra-wideband radio connectivity and upload close contact data to a server or cloud. And in the event an employee self-reports and updates their status with their employer that they have tested positive for COVID-19, an employer can use the data it has collected from, let's say, the past week or two from the wearables to see who may have come in close contact with that individual. And the tool may update and notify those affected that they have been in contact with someone who reported that they tested positive for COVID-19 based on the proximity and location data history. So this data is logged so that possible contacts are detailed for internal use in an organization and any manual follow-up meetings that are needed. It also identifies areas in the workplace that the exposed individual had been to ensure that the areas are cleaned and sanitized properly. So this can be a useful approach to limit data collection to its intended purpose and provide exposure notifications without identifying specific individuals beyond the organization's designated persons who are reviewing the data and coordinating the effort. It really is a way to assist and augment the capabilities of the employer's designated contact tracers. And of course, employers want to use this location history for this limited purpose, not to analyze why certain individuals are spending certain times in the cafeteria or why certain people may be talking to each other or other unrelated purposes. And thought should be given to where the data is being located and how and when it can be purged when it is no longer needed. Employers must also, it's very important to explain to the employees why they may be required to use these tools, and also for the employer to treat any data collected with care, mindful of privacy and security considerations and all applicable workplace laws.
For healthcare providers, contact tracing raises a host of staffing, patient management, and patient safety concerns. What types of things should healthcare providers consider to address the issues contact tracing raises?
I'll start with staffing considerations. From a staffing and patient management perspective, healthcare providers need to first ensure that they are following all workplace protocols and guidelines as the foundation of their overall safety plan. And despite all the precautions in the healthcare workplace, and hopefully is followed by the healthcare worker outside of the workplace, when there is a healthcare worker with a suspected or confirmed viral infection or COVID-19, there are testing protocols that go into play and decisions about return to work timelines for which such worker will depend on whether they remain infectious, the local circumstances, and additional decision points. Once the appropriate timelines have been determined to clear someone to return to work, CDC recommends that they continue to self-monitor for symptoms and wear the appropriate face mask and equipment. So while with staffing shortages that occur during a pandemic, healthcare facilities need plans and processes to mitigate them, including use of temporary staff and determining how to acquire and hire them. There may be rotating situations, moving infected staff to remote telehealth platforms and rotating in the staff that were previously remote. Or there may be a need to determine when staff can return to work without meeting all of the return to work protocols with extra protective measures in place. Of course, all of this movement of staff and potentially patients raises additional issues of spreading any potential virus and further complicating contact tracing efforts. And it's also difficult to keep track of all this movement and changing situations. So there's a massive amount of planning and replanning, revisiting plans for all these workplace scenarios and patient management issues. So any contact tracing plan needs to account for these variables and movement of new people into the facility's environment, not to mention the privacy and communications issues, which Karen will address.
Thanks, Michelle. There are a whole host of other issues, including privacy challenges, that the COVID-19 public health emergency has created for entities that provide healthcare services, including how to respond to inquiries from the media, inquiries from family and friends of patients, or from public health authorities. Disclosures of protected health information to the media may not be made without the patient's written authorization. However, patient information can be shared with family and friends with the verbal permission of the patient, and if the patient is incapacitated and the provider determines in his or her professional judgment that doing so is in the patient's best interest. Finally, with respect to inquiries from the public health authority, the provider should get confirmation that the inquiry is actually coming from a public health authority and that it is an authentic request, and that the requester is in fact authorized to obtain the information. If the request is bona fide, the provider is permitted to make the disclosure, and even if the request is for fully identifiable health information, the provider can rely on the fact that the public health authority is requesting the minimum necessary information needed. In the event that a provider or employee tests positive for COVID-19, the entity should notify their workforce and any patient that the provider or employee came in close contact with. It should not be necessary to reveal the identity of the provider or employee who tested positive. However, notifying the workforce based on symptoms alone may be over-inclusive, and the entity should consider all the circumstances, especially during cold and flu season. Given the rapidity with which tests can be administered, it may be more effective to isolate the provider or employee and confirm whether they test positive or not before notifying the workforce on the other members of the workforce unnecessarily. Each case, though, should be evaluated to consider what the best course of action to take is. Finally, in order to avoid the tendency for people to gossip, healthcare providers should remind their employees that HIPAA basics such as confidentiality, role-based access to patient information, and authorized uses and disclosures of patient health information are still the expectation and the law, and employees may be sanctioned for violations. Specifically, employees should be reminded that if a prominent member of the community, a local politician or celebrity, tests positive for COVID-19, that information is not to be discussed at the water cooler or among coworkers or friends. Even though the Department of Health and Human Services has exercised enforcement discretion with respect to many aspects of HIPAA enforcement, healthcare providers are still expected to comply with the privacy and security rules during the public health emergency.
Thank you both. This information will be helpful for healthcare providers to consider as they develop and revisit their policies and procedures. Now, can you talk about any consent or authorization requirements associated with the collection or use of PHI, such as COVID-19 test results, versus other types of PII?
Sure. Let's start with what Protected Health Information, or PHI, is. Protected Health Information is a term of art from HIPAA. The HIPAA security and privacy rule applies to healthcare providers, health plans, and healthcare clearinghouses, and require that they protect the privacy and security of a patient's health information that they collect and manage. Asking an employee to self-report their COVID-19 status results does not necessarily implicate HIPAA. However, an employer is obligated to treat that type of medical information that they are collecting as sensitive employment information. While no HIPAA consent or authorization is required, an employer may still be under an obligation to provide adequate notice to employees regarding what information is being collected, how it will be used, and how long it will be retained as an employment record. When an employer uses an app to collect employees' information, the employer should review the app's terms of use and privacy policy, and employees should be directed to them as they form the basis for how the personal information about them being collected will be treated. In the context of contact tracing technologies, the more accurate and up-to-date the information being collected is, the more efficient and effective the tools can be. With so many more people getting tested for COVID-19 and many employers offering testing to employees who may be exposed, some IT developers have or are considering expanding the capability of their contact tracing apps to be able to collect test results directly from labs or the healthcare providers who administer or order the tests. HIPAA allows an individual to authorize a healthcare provider, like a lab or their physician, to disclose their electronic protected health information to a third party like their employer through a mobile application that is not subject to HIPAA requirements. Employers should be mindful of any applicable state law requirements that govern notices to employees' consumer rights, applicable consents, and breach notification requirements. One such state law that has garnered a lot of attention are the protections offered to consumers under the California Consumer Protection Act, or CCPA. However, when it comes to medical information, if the information is governed by the California Confidentiality of Medical Information Act, or under HIPAA, as a general rule, the CCPA does not apply. Also, businesses covered by the California Consumer Protection Act will have at least one more year to prepare before the exemption for personal information collected from employees will end. And earlier this month, Proposition 24, also known as the California Privacy Rights Act, was on the ballot in California and was approved. It expanded and amended the CCPA to allow consumers to direct businesses to not share their personal information. It also removed the time period in which businesses can fix violations before being penalized, as well as it created a privacy protection agency within the Attorney General's office to enforce the state's consumer data privacy laws. Therefore, employers and businesses in California utilizing mobile technologies for contact tracing should be mindful of the CCPA and CPRA requirements and carefully consider the information being collected. They should pay attention to any changes with respect to the effective dates that have been a moving target, as well as the enhanced enforcement power that the CPRA placed in the Privacy Protection Agency. Similarly, from a GDPR perspective, guidance from the European Data Protection Board indicates that employers will be able to collect and process personal information in the context of COVID-19 to protect the public interest in addressing the public health crisis. However, employers should still try to limit what information they collect about employees or visitors to the workplace.
It's also interesting to note that a lot of the concepts from the GDPR are making their way into the introduction of new legislation in the US and amendments to existing state laws. The concepts of purpose of use limitations, encryption protocols, greater transparency, choice and control over data collected by contact tracing apps, privacy disclosures at point of collection regarding how data will be handled, requirements to delete or de-identify data at the end of the public health emergency. So as Karen mentioned, Proposition 24, or the CPRA, reinforces and redefines parts of the CCPA regarding how companies collect and use personal information. And the CPRA will close several loopholes in the existing privacy law and make it easier in some circumstances for people to opt out of having their data collected or processed. And there are bills with these concepts that have been introduced earlier this year, such as the Public Health Emergency Privacy Act and the COVID-19 Consumer Data Protection Act, as well as proposals to award grants to states and public health agencies to develop and administer programs for digital contact tracing, such as the Secure Data and Privacy for Contact Tracing Act, as well as to allow grants for other entities to conduct testing, tracing, and monitoring of contacts of infected individuals under the COVID-19 Trace Act. So there will be many more developments in this area that need to be monitored so that any required changes to approaches are made and safeguards put in place.
As our last question today, for companies looking to develop and implement a contact tracing program, how can they balance workforce safety and individual privacy rights? What goals should they keep in mind?
Employees need to be able to trust that their data will be secure, that it won't be misused by their employer or third parties or used against them in employment matters. Employers need to have a communication plan when deploying the tools and apps to explain the need and garner trust, and provide any required disclosures and obtain buy-in from employees, as well as do their diligence on vendors, the tools, the apps, and incorporate these measures into their cybersecurity protocols and data breach response procedures. All employers, whether subject to specific laws to do so or not, should strive to use data minimization and limited use approaches, invoke data storage limits, and implement transparency and opt-in participation measures.
To address privacy concerns, employers should collect only the data that they need to know when an employee is suspected or actually infected by the virus, so that other employees that have been exposed to the infected employee can be warned of their potential exposure and can be instructed to take measures to isolate, get tested, and in doing so, the virus can be contained as opposed to closing down the whole business or a whole city. And as with any collection of sensitive data, that information needs to be protected both from being misused and from being compromised or hacked. Contact tracing apps and technologies that collect personal information, including information considered medical or biometric, could be subject to state laws that require notice and may be subject to federal and state consumer protection and breach notification laws. So employers must be clear and transparent, communicate frequently to make sure that employees understand the important role they play in keeping themselves, their families, and their fellow employees safe.
Thank you both. Before we wrap up today's podcast, is there anything else you want to leave our listeners with today?
At a high level, everything that we do, every piece of data that we create, has the potential for being used for purposes we may not even be aware of today. And it can be leveraged, sold, stolen. And we need to recognize that when it is time to stop contact tracing and collecting data in other situations, that we do so. It's recently been reported that in order to attend concerts next year, it may be necessary to report to an app whether you've been vaccinated or whether you have COVID-19 within a short window before attending the show, or you will be denied entry. And this kind of approach is being considered in order to travel and work. And there are proposals by the new administration to hire 100,000 contact tracers across the country. So we need to be mindful, what is the purpose? And are we using these tools, apps, and approaches to achieve the intended goals? What kind of society are we creating? There are definitely efforts to shape policy in this area and repeated calls for federal privacy legislation. We all need to be part of the conversation to maintain and preserve our rights and liberties.
As we continue to move into the next phase of this pandemic, even more personal information will likely be needed to help predict where hotspots may pop up, what the best ways are to protect against being exposed, and what seems to be working to slow the transmission of the disease, and whether treatments and vaccines are working or not. And as we do move closer to vaccine development and deployment, even more personal information will be needed to be collected, analyzed, and used to design AI tools to help predict which vaccine might be the most effective for certain populations, or when and where vaccines need to be deployed to prevent an outbreak, and possibly to determine whether someone has been vaccinated before being granted to entry into a particular venue. Even with the availability of vaccines, it'll take several months for them to be distributed across the population, and contact tracing will remain relevant in our near future and beyond. The most important factors in helping people feel confident about sharing their personal information is to be truthful and to protect the information being collected from improper uses and from breaches. If people have a good understanding about how their information is being used, then most people are willing to contribute their personal information if they trust that they are participating in something that brings about a common good.
Thank you so much, Michelle and Karen, for taking time today to speak with us about privacy issues related to contact tracing.
Thank you, Jessica. It's been great talking with you today, and the questions were really wonderful. I appreciate it.
Yes, thank you, Jessica. It's such an important topic, and it was great that we had this opportunity to share our comments with you all today.
I want to take a few moments to recap some of what we heard today. First, a comprehensive method of contact tracing is needed to get people back to work and the economy moving, but it is important to contact trace for the limited intended purpose of reducing COVID-19 infection risks. Second, employers using mobile technologies for contact tracing and social distancing purposes must address privacy and security considerations when selecting vendors and negotiating service agreements, vetting tools and apps, and handling, transmitting, and storing data. Lastly, employers must also stay abreast of changes in the law impacting these tools and apps and pivot swiftly to address them. It's important to have appropriate advisors available to assist. Well, that's all for today's episode. On behalf of Epstein, Becker, and Green, thank you for tuning in. I'm Jessika Tuazon, and this has been Diagnosing Health Care. We look forward to having you join us again.
Thank you for listening to Diagnosing Health Care. For show notes on today's episode, additional episodes, and more insights on trending issues in healthcare, please visit diagnosinghealthcare.com and be sure to subscribe on your preferred platform. The Employment Law This Week and Diagnosing Healthcare podcasts are presented by Epstein, Becker, and Green, PC. All rights are reserved. This audio recording includes information about legal issues and legal developments. Such materials are for informational purposes only and may not reflect the most current legal developments. These informational materials are not intended and should not be taken as legal advice on any particular set of facts or circumstances, and these materials are not a substitute for the advice of competent counsel. The content reflects the personal views and opinions of the participants. No attorney-client relationship has been created by this audio recording. This audio recording may be considered attorney advertising in some jurisdictions under the applicable law and ethical rules. The determination of the need for legal services and the choice of a lawyer are extremely important decisions and should not be based solely upon advertisements or self-proclaimed expertise. No representation is made that the quality of the legal services to be performed is greater than the quality of legal services performed by other lawyers.